Ginger, with its robust flavor and numerous health benefits, has long been celebrated as a versatile remedy in traditional medicine and culinary practices across the globe. From soothing upset stomachs to providing relief from nausea and inflammation, ginger's medicinal properties are well documented. But did you know that despite its remarkable properties, ginger might not be suitable for everyone? Just a quick reminder, the content provided in this video is for informational purposes only and should not be considered a substitute for professional medical advice, diagnosis, or treatment. Let's delve into 7 health conditions where ginger might not be your ally. Number 1. Bleeding disorders. Bleeding disorders, such as hemophilia or von Willebrand disease, are characterized by difficulties in blood clotting. And here's where ginger enters the picture. You see, ginger contains compounds known as gingerols, which possess natural anticoagulant properties. This means that ginger can potentially interfere with the body's ability to form blood clots, leading to increased bleeding. For individuals with bleeding disorders or those taking blood-thinning medications, such as warfarin or aspirin, consuming ginger in large quantities could exacerbate their condition and heighten the risk of excessive bleeding. So, if you or someone you know has a bleeding disorder, it's essential to approach ginger consumption with caution. Number 2. Diabetes. First off, let's talk about how ginger affects blood sugar levels. Ginger contains compounds that have been shown to lower blood sugar levels, which can be great news for some. However, for those with diabetes, it's a bit more complicated. Ginger's ability to lower blood sugar levels means that when combined with certain diabetes medications, it can potentially lead to hypoglycemia or dangerously low blood sugar levels. Now, while managing blood sugar levels is crucial for those with diabetes, it's equally important to consider how ginger might interact with medications. If you're taking medications to lower blood sugar, adding ginger to your diet could enhance their effects, leading to a sudden drop in blood sugar levels. This can be particularly risky, especially if you're not closely monitoring your blood sugar levels or if you're taking multiple medications. Number 3. Heart conditions. While ginger can be a flavorful addition to your diet and offer many health benefits, it's essential to be mindful of its potential effects on the heart, especially if you have an existing heart condition or are taking medication. For people with heart conditions like arrhythmias or those taking blood-thinning medications, consuming ginger could potentially increase the risk of bleeding episodes or interfere with the effectiveness of their medication. Secondly, ginger's ability to lower blood pressure can be a double-edged sword for individuals with heart conditions. Consuming ginger in large amounts or combination with certain medications could potentially cause blood pressure to drop too low, leading to dizziness, fainting, or other complications. Lastly, ginger's stimulating effect on the cardiovascular system may not be suitable for everyone. For individuals with conditions such as atrial fibrillation or hypertension, the increase in heart rate and blood flow that ginger can induce may exacerbate symptoms or cause discomfort. Number 4. Gallstones. First off, let's understand what gallstones are. These are hardened deposits that can form in your gallbladder, ranging in size from tiny grains to large golf balls. They're typically made of cholesterol or bilirubin, and they can cause some serious discomfort. So, why should those with gallstones be cautious with ginger? Well, here's the deal. Ginger stimulates the production of bile. While this is usually great for digestion, it can spell trouble for individuals with gallstones. When the gallbladder contracts to release bile into the digestive system, it can trigger painful spasms or even worsen existing symptoms for those with gallstones. This can lead to more discomfort and potentially aggravate the condition. Number 5. Surgery. Ginger has natural properties that can thin the blood and inhibit blood clotting. While this might be beneficial in some situations, it poses a significant risk during surgery. During surgery, your blood must clot effectively to minimize bleeding and promote proper wound healing. However, consuming ginger before surgery can interfere with this process, leading to excessive bleeding during and after the procedure. Excessive bleeding during surgery can complicate the procedure, prolong recovery time, and increase the risk of post-operative complications. To ensure the safest possible outcome, it's essential to avoid any substances that could interfere with blood clotting, including ginger. If you have an upcoming surgery scheduled, it's important to inform your healthcare provider about any supplements or herbal remedies you're taking, including ginger. Number 6. Underweight individuals. For individuals who are underweight or have difficulty gaining weight, this can pose a challenge. You see, a faster metabolism means burning more calories, which might make it harder to achieve a calorie surplus necessary for weight gain. Moreover, ginger's digestive properties can lead to a feeling of fullness or satiety, which might reduce overall food intake. For someone trying to gain weight, feeling full too quickly can hinder their efforts to consume enough calories throughout the day. Number 7. Pregnancy and breastfeeding. First and foremost, let's address ginger's ability to stimulate the uterus. While ginger is generally safe in small amounts, excessive consumption during pregnancy can potentially lead to uterine contractions, raising the risk of premature labor or miscarriage. Furthermore, ginger has been known to cross the placenta barrier, exposing the developing fetus to its active compounds. While research in this area is still limited, some studies suggest that high doses of ginger could potentially harm fetal development. But it's not just during pregnancy that caution is warranted. Breastfeeding mothers should also be mindful of their ginger intake. Compounds in ginger can pass into breast milk, potentially affecting the nursing infant. Additionally, ginger's ability to lower blood sugar levels could pose a risk for breastfeeding mothers, especially those with gestational diabetes or a history of low blood sugar. Whether you're expecting a little one or nurturing your newborn, your health and the health of your baby are of the utmost importance. So, before reaching for that ginger tea or adding ginger to your meal, take a moment to consider the potential risks.